Hi, good morning, everyone. Those are all really tough acts to follow. I work in HIV research at the Center for Global Health Nursing. And as many of you know, we've come a very long way since the early days of the AIDS epidemic, when an HIV diagnosis was essentially a death sentence. Now we have antiretroviral medication that can help people lead long and healthy lives, and it can virtually eliminate any risk of transmission of the virus to one's partner or from mother to child. The challenge, and where we fall down, is actually in our ability to deliver these proven interventions to people in a way that in a way that's acceptable to them and that can work within the constraints of weak healthcare systems. Nurses, as the frontline health providers in HIV services, are key to solving these persistent problems in global health, and that's where nursing research comes in. I'll give you an example from my work. So despite this great technology, these proven interventions that we have for prevention of transmission of HIV, there's still one age group that is actually getting worse and not better as a result of HIV. They have an increase in HIV incidence, and they're also seeing an increase in AIDS-related mortality. This age group is adolescents. In my work in Kenya, we talked to 17 and 18-year-old adolescents who tell us stories about being on antiretroviral medication for their entire lives, and no one ever told them that they had HIV because the stigma of the disease was so great. They also told us stories about having really poor interactions in health settings where the nurses and the doctors didn't treat them very well. So they left and they never came back to care. On the other hand, we work with a lot of nurses and doctors, and they tell us, we know this is a problem, we really want to help them, we know we need to provide adolescent-friendly care, but as a theory, adolescent-friendly care is great, but what does it look like? How does one do it? So we saw this as a problem, we all got together and we had an idea. I got a small seed grant from the School of Nursing that enabled me to get trained in patient actor methods. The way that this works is it's a simulation, but instead of using mannequins, you use real-life people, where trained actors can portray a patient case, and then the healthcare provider has the opportunity to practice their care in a controlled and safe setting where there's no risk of harm to the patient. And there is a lot of evidence in resource-rich settings that this type of simulation actually can improve the quality of care, specifically around communication skills, empathy, and breaking bad news like HIV diagnosis. There is also evidence that this in turn results in better clinical outcomes for the patients. So this grant that I got allowed me to get trained in this approach. It also allowed me to spend a little bit of time writing an NIH grant proposal, which was funded. So this $10,000 investment that I got from the School of Nursing translated into $1 million NIH research grant is a clinical training intervention using standardized patient actors to improve the quality of care for HIV-infected adolescents living in Kenya. Investing in the next generation of nursing scholars can give us the opportunity to promote even more innovative solutions for persistent problems that we see in global health and HIV care. I propose today that we start a seed grant or a pilot funding program for junior faculty and trainees in global health nursing. This kind of research that we do in nursing has potential for real-world, meaningful impact at a global scale. The $6,000 offered up today could actually fund 2 predoctoral trainees in implementation of their fieldwork for their dissertations. Or slightly larger grants could actually launch the careers of postdoctoral fellows or junior faculty like myself. Like the 100 times return on the gift invested in me, your contribution today could result in powerful change we can only imagine. Thank you.